Hello, my name is Dr. Aashish Contractor and I am a preventive cardiology and rehabilitation specialist. Okay, so let's talk about exercise. The question most people have is not what's the maximum exercise I can do, rather the question is what's the minimum I can get away with. So let's talk about the minimum you can get away with. Ideally, you should try and do some form of physical activity every day of the week. So 30 to 60 minutes of physical activity, and this could be something as simple as a brisk walk every day. So for example, you could walk to work or walk to the railway station if you're going from home to a railway station. So 30 to 60 minutes is ideal. Remember, something is better than nothing. So if you're not able to fit that in, even if you took 10-minute walks 3 times a day, that would be good enough. Earlier research showed the benefits of regular exercise. Today, research is looking at the negative effects of inactivity. So they have found that just sitting for long periods of time, which frankly most of our jobs involve, is extremely detrimental to health. So even if you have a sedentary desk job, get in the habit of every 45 minutes or an hour getting up and maybe just literally taking a 5-second stroll and sitting back down. Or if you're at work and you are on the phone all the time, maybe you can answer your phone or talk on the phone while standing, or even better while taking short paced walks up and down. If you're looking at structured exercise, then 3 to 5 days a week of 30 to 40 minutes would be excellent. Playing a sport, so whether it's running, swimming, badminton, squash, all of that is great. The idea is to do a mix and match. Get your regular exercise in as well as daily physical activity in. Today, many people are wearing gadgets like the one I've got on my wrist, which measure your physical activity. They talk directly to your cell phone. Those are all fantastic. So, whatever inspires you, you need to do, but just make sure you're physically active and you get your 30 to 60 minutes in on most days of the week. Diet is always a very difficult subject to comment on. Everybody's got an opinion, and fortunately or unfortunately, science literally changes every few months. They used to say eggs are good for you, then they said they're bad for you, now they're again saying they're good for you. So how does one really address all of this? Interesting part actually is that good results have been shown with people even with extremes of diet. But the one common point is that whichever diet you do select, make sure that you stick to it. So you get success when you stick to a diet. So some people have a high carb, low fat diet, and some people have a low carb, high fat diet. But if you combine both, you're clearly not going to get results. So having said that, the diet for heart disease has traditionally always been one which is higher in complex carbohydrate and lower in fat, especially saturated fat. Now, while some of these principles are honestly being discussed and debated even as we speak, let me give you what I would consider 3 or 4 current tips that would be most relevant. And if science changes 1 year from now, please don't hold me to that. The first thing is your quantity of food is extremely important. So if you are optimal weight, so if you are BMI less than 25, then that's fine. The current quantity that you're taking is fine for you. If you need to lose weight, then you need to focus on reducing quantity. So irrespective of the quality of your diet, quantity is very important. The second is try and reduce your intake of processed foods. That's one area where there really isn't any discussion or controversy. Everybody says that your processed food intake should be under control. The third is avoid both excess sugar and fat. Earlier, for the last 15-18 years, fat was the main villain. Today, more and more people are considering simple sugary items the villain. So simple sugars and fat, both, let's have it in moderation. I'm not saying that you have to cut off both completely from your diet, but things like, yes, cold drinks, etc., sweets, the more you keep them under control, the better it is for you. In terms of fat, there are healthy fats today which are available in naturally occurring foods, say such as avocado, which are good for you. But I would still stay away from deep fried items. I would still reduce the intake of excessive saturated fat. If you're a vegetarian person, then a lot of the fat could come from, say, full fat paneer, full fat dairy products. And while I would recommend eating them, I would say keep the quantity under control. If you're non-vegetarian, keep your red meat intake under control. with more research coming out, I don't think we need to eliminate it completely, but keep it in controlled quantities. Where salt is concerned, again, that's an area where people are debating, but if we limit salt intake, I think that would be best for you. So again, to sort of sum it up, take care of portion control, control your intake of processed food, more of complex carbohydrates, keep simple sugars and fat under control. Thank you.